the best
People buy
for one
islands.
week. You know how much it costs?
A lot.
$30,000. You better not sleep if you're gonna spend $30,000 in
That's
No.
seven
too
days.
much. Just to stay somewhere.
They just wanted to treat themselves.
If I'm gonna spend $30,000, I'm gonna go to Hawaii and rent a cheap
Business so they can afford
Yeah.
a cheap little one bedroom
Mhm.
somewhere and stay for a month.
Oh
What's
yeah.
about
I would do that.
$30,000.
I'm too cheap. I could be a billionaire and I'd still be cheap.
I think that's the best way to go. I'd rather be cheap than overspending.
Yeah.
Saving for a long time.
Okay. So much about daydreaming.
Yeah. After lunch.
So now, so this is
Back
still
to
part of your
reality.
cardiovascular system. Okay. You know, when you're done with the study of A and B, oh, is it too?
That's too
Yes,
much.
please. Can you turn it up?
Just a little bit.
There you
Too much. Down.
Too much?
In the middle. Nope, that's not the middle. Right there.
There.
Okay. So, if you think about it, I know before we even talk about the arteries, capillaries, veins, you know about that one. I'm just gonna go to this part right here. Look at.
Pulmonary circuit systemic.
So there's your, there are your blood vessels, and there's two it's like two blood flow tracts, one going to the lungs and the other one going to the rest of the body called systemic, okay? Pulmonary and systemic circulation. We know, or I hope you know that these three main blood vessels, we're going to talk about this is the next chapter, but you should know that arteries, A for away, they carry blood away from the heart. Veins, IN, they carry blood back into the heart. And the arteries, so if you look at this picture, they always color the arteries red, but don't forget when we study blood vessels, both oxygenated and deoxygenated blood are present in both blood vessels, okay? So you remember maybe when you were in high school, they say arteries carry oxygen, veins carry carbon dioxide. That's a wrong, it's an incomplete sentence, okay? Both arteries, anyway, both gases are present in any of the blood vessels, okay? So this is how, what happens, right? The artery is carried, we know it, it carries precious gas, nutrients, right? So I'm going to write down my GI tract right here. Every day, you just think about your body as like a little factory, like a little building, and you have first floor, second floor, third floor. You have tiny little people walking up and down, messengers, right? Delivering the mail to the people, and then they're picking up your trash. They have to go back and throw the trash out to your pee-pee. That's the only trash can, right, by the pee-pee and the lungs. Because the poop, we're going to talk about the poop, right? But the only trash, the way to dump our trash is through your kidneys and your lungs, okay? So that's what's going on. So I have my tiny little people, see, delivering oxygen here, and the people here, and when they go to the GI tract, they pick up nutrients. See, they pick up nutrients, and then they join here, and then this one, this nutrient-rich blood. See, as they unloaded the oxygen here, they're picking up carbon dioxide. You're going to be asked to do this one. By the time we're done with the digestive system, I usually ask the students to write down a diagram and then discuss, just so I know that you understand.
So
It's you're not
getting rid of oxygen and picking up O2.
you're gonna understand this more when we study the rest of the cardiovascular system. I'm sorry, the digestive system. So here's my GI tract. This is oxygen-rich blood. The oxygen is going to be unloaded here to nourish my cells. And my cells have trash. This is what I mean, your little people delivering oxygen, then they're picking up your trash, which is called carbon dioxide. And then the carbon dioxide is going to be taken by my little people, deliver it. See, look at, it's going to go to the lungs. This is how you get rid of your carbon dioxide. But there may be other kinds of trash which the lungs cannot get rid of. So it makes another round trip. Now it's going to go to my kidneys. And the kidneys are the ones that's going to get rid of my waste in the form of urine. Right now, it may still be a little bit confusing to you guys, but I promise you, when we're done, usually after the renal system, you will have a nice picture of everything that's going on in your body, and you won't have a hard time doing this drawing for me, just so I know that you all understand. Picture again in your head, my heart pumps, it's pumping the nutrient, the oxygen-rich blood going to my GI tract. In my GI tract, it's unloading the oxygen. That oxygen is going to be used by my GI to process the nutrients that I just ate. So in exchange, the GI tract will give to my blood my nutrients, the glucose that I just ate. It's also going to give them carbon dioxide. That's my waste. So where is that waste and nutrients going? To the right side. The carbon dioxide going to be blown off as I breathe out. And where's the rest of the waste? Anything that's not carbon dioxide, like lactic acid, uric acid, all of those, maybe toxins, maybe the vitamins, also the waste, the metabolic byproducts. It's going to go to the kidneys. I deliver it, I pee it out. That's why urine is waste. So, why did I talk about that now? What is the link? What is the one that makes sure, what is your main generator that makes sure that your tiny little minions keep moving? It's the heart. The heart pumps to push your minions, right? Your people. Like you have to push your blood. The heart is the one. Look at this picture. If you look at this picture, the cardiovascular system is a closed circuit. It's closed, which is very important for us to remember. It has to be closed because can you imagine if it's open? Then when there's an opening here and all of the blood leaves, how can you generate pressure again? Right? Does it make sense? It has to be a closed circuit. Okay? Do you understand? So the heart is nothing but modified. All the linings of the heart is the same as the linings of the blood vessels. Just think of it. I like to draw it this way. See? The same lining. The same lining. The heart is just an enlarged blood vessel. And then it has 4 chambers. Because its job is to separate the pulmonary circulation from the systemic circulation. Pulmonary from systemic. Okay? So the right side of the heart delivers blood to the lungs. What type of blood do you think is being delivered to the lungs? Oxygenated or deoxygenated?
Deoxygenated.
Yes, very good. When the blood that goes to the lungs is deoxygenated, low in oxygen, high in carbon dioxide. And what's going on in the lungs is the lungs will get rid of the carbon dioxide, you blow it off, but it will also give the oxygen. You just breathe in the oxygen, it will give it to your blood, right? So that when it returns to the left side of the heart, the left side will pump oxygenated blood to the rest of the body. It's a never-ending cycle. The moment the heart beats, that's what it does. Before we can appreciate everything about the heart, there's a few things I want you to remember. Okay? Location. It is located, what is this body cavity?
Right.
Yes. What do you notice? There's another organ here. What is it?
Lungs.
The lungs. Okay? There's something very important about the fact that it shares the thoracic cavity with the lungs. By the way, the specific cavity occupied by the heart only is called
Cardio.
yes, pericardial cavity. And in the lungs, it's called
Pleural.
Yes, very good. Pleural cavity. Okay, so pleural cavity and pericardial cavity. This is telling me that they have their own specific bedroom, even though they live in the same house. And you know what? There's a sign right here, do not enter. Same with the lungs. Did you notice people with maybe you know some people who had pneumonia, they still have healthy hearts, right? So what I want you to realize is, even though they're very close, you're going to look at the heart now when you open up the cat. You will see how they're very close. But lung infection does not necessarily mean you're going to have an infection in your heart, and vice versa. What makes that possible are the membranes that cover them. For the lungs, it's called pleura. We're going to talk about the pleura when we study the respiratory system. For now, we look at this pericardium. Okay?
That's the membrane for the.
That's the membrane that covers the heart. And so I want to bring this up. So here is your thoracic cavity, right? And there's your pericardium, okay? One thing you need to know, look at this pericardium. When you open up your heart, it's not a loose sac, okay? It's tight. So the function, and the pericardium, there's two layers, an inner lining, so inner is always called visceral and outer is always parietal. Anytime you see a visceral lining, you know that that lining is stuck to the substance of whatever organ it's trying to cover. It's stuck. Okay? And then the outer is called parietal. So there's a space in between called the pericardial space. And this pericardial space is filled with fluid, the pericardial fluid. Okay? And the function of the fluid is to promote friction-free environment. When the heart pumps, it's not painful. It's just friction-free. Okay? And I want you to look for this one, so that you can explain to your patients and you can prove to yourself. Look at this. The pericardium is what type of tissue you think? Mainly connective, isn't it? Right? And I want you to prove to yourselves if this is true. The pericardium actually, this one fuses with the membrane of the diaphragm. You will see it, how it's really fused. And this is why when you have post-op patients or on a regular basis, they always say deep breathing will help promote a healthy heart. That's true. Look at, we know that the diaphragm is involved in breathing. So when you breathe, because they're fused, don't you think that will help in the health of the heart? Don't you think so, right? That's why we say deep breathing, deep breathing. It will help in the activity or the health of the heart. Okay? You know, have you heard of the word pericarditis? That's inflammation, accumulation of fluid. When something gets inflamed, it gets filled with fluid. This pericardium has a lot of what do you call this? Pain receptors, nociceptors, okay? Free nerve endings. and they're very sensitive to pain. Pericarditis is a condition where the cause or the etiology is generally difficult to figure out. It's very common among radiation patients, radiation treatment patients, or cancer patients on chemotherapy. You always watch out for pericarditis. When you have a patient on cancer treatment and then they complain of chest pain, you never take that lightly. It may be that they're having pericarditis. It can also follow after a viral, and no one knows what is the cause of pericarditis, but it can happen at any age. Why is pericarditis dangerous? I told you that the visceral pericardium is stuck to the substance of the heart. Look at, when this gets filled with fluid, okay, it's filled with fluid, number one. And we know that the job of the heart is to contract, right? For muscle to contract, it needs what? It needs to be stimulated, right? So I'm looking at this heart. There are two parts to the heart, right? When it's contracting or when it's relaxing. By the way, are you familiar with systole and diastole?
The blood pressure.
That's very
No.
good. It's true.
That's
The
the
blood
blood
pressure.
pressure.
Yes. Systole is the phase where the heart contracts. So when it's contracting, that's what you call systole. When it's relaxing, it's called diastole. Very good. Okay? So look at this one. When you have pericarditis or any kind of swelling right there, during systole, the heart is pumping the blood to nourish your body, right? During diastole, the heart should be relaxed to receive blood, right? And look at this. Where will the problem be when a patient has pericarditis? When a patient has pericarditis, predict. Do you have any problems this systole? No. What would be your problem?
Relaxing.
Relaxing. Because why? Remember, muscles can only pull. They contract. Remember, and nerves help them to contract. There is no nerve that tells them to open up. The relaxation part is just the elastic part. Remember, the actin and myosin, you have the elastic forces pulling, and then the gravity, and then the antagonistic muscles. You have no antagonistic muscles here, right? So when you have pericarditis, that's the danger. The danger is, which of the two? This is going to be affected. And when it's not able to open up, what do you think? You're going to compromise. There will be a back flow right here, right? You see them. These are the patients you see. You look at the neck. Look at your neck. Your neck, I don't see any magnified beating of the blood vessels. But people with any kind of compromise right here, you see this one, bounding pulses over here. You understand the effect of pericarditis?
So I'm just curious if you have an increased diastolic,
That
does that mean your heart is
That's
not
a very
relaxing?
good question. Well, yes, we're gonna talk. That's very good. You see, look at you guys. You're thinking now, but we're gonna talk about it when we study the blood vessels. Amazing. That blood pressure reading, the systolic versus diastolic, it tells you something. Okay, we're gonna talk about it in the next chapter, but it's very important for you guys to. You need to remind me. Okay. Okay. One more thing. So, it's locked up, right? It's like there is no room for expansion for the heart. Besides, look at this one, right? This is the thoracic cavity. This is bone. Does the bone expand to accommodate anything that enlarges there? No. What is the composition of your heart? What is the main bulk? What is the main tissue type in your heart? It is? Yes, it is muscle, isn't it? So, You see some sexy guys, they do their weightlifting. What happened to their muscles right here? It bulks up, right? Look at, when I do resistance, when I am hypertensive, isn't that resistance exercise for my heart, isn't it? So when there's hardening of my aorta, or there's a cholesterol plaque right here, let's say, there's resistance. My heart has to pump to deliver all the blood that it just received. It has to pump it to deliver it here. If there's any kind of resistance here, right, what will happen to the heart? Has to work harder. What is the end result? Just like this one, it will start bulking up, right? But what's the difference? Here, no problem. I can see sexy. You say, oh my, you're so sexy. Look at that. This one, can you say? No, right? Because why? There is no room for expansion. It is not good to have an enlarged heart. And that's what will happen and that's what we're going to talk about. You were asking about the systolic and diastolic. Hypertension is a serious problem. That's why it's referred to as the silent killer. You can still function because you function because it's still able to pump blood, right? In the meantime, there's something silently going on in your heart, and if you don't take care of that, you can die. And again, we're moving way ahead. We're going to talk about the implications of blood pressure readings when we get to the blood vessels. But for now, do you understand why an enlarged heart is not good? Just think anatomy. Think about where it's located. Think of the fact that it's locked up. I guess locked up is not the word, but there's no give because of the pericardium and this one. It's different. Skeletal muscle, it's okay to show off your cannons. It's called cannons, isn't it? But here you can't show it off. You can't say, oh, look at my heart. It's set. You can't do that. There is no give. Okay? Okay? If I ask you that in the test, you understand. So, a few other generalizations about the heart. If I find it. Okay. Okay, here you go. Right, look at this one. It is fatigue resistant. Does it make sense? You cannot tell your heart, go take a rest, right? Go on vacation, go sleep. You cannot tell your heart to do that. The moment it started beating within the first trimester, the only day it will stop beating is if you're dead, right? If it's always beating, it's telling me that you always have to make sure it's not picky as far as the nutrients. Look at it, can use whatever nutrients you have. But there is a catch as far as heart metabolism is concerned. I know that we learned that glucose is the main source of energy, correct? For the heart, it's different. It prefers fat. This is telling me that I really have to watch the type of fat that I have in my diet. What is, by the way, remember the triglycerides? Remember that? This is this one, right? The adipose, not the cholesterol. Don't forget, we don't burn the cholesterol. It's the type of fat, the saturated versus unsaturated. It's telling me that as long as there is fat in my body, that fat will always be dislodged or released to be delivered to the heart, because that is the preferred nutrient of my heart, the fat. Okay? Did you understand? You got that? Okay, so you always, that's why you explain to your friends, you gotta make sure you always have the good type, the unsaturated fats.
The kind that
It
liquefies.
doesn't, huh?
Is the unsaturated fat the type that liquefies?
The
flows?
liquid, yes, correct. It doesn't stay here. This one, the belly fat that we see today, that's different from the belly fat yesterday. The one yesterday was released to supply my heart. This is new one, right? It's always being released to supply my heart. Another thing about the heart, see, look at it has large mitochondria, okay? It is autorhythmic. It is autorhythmic. What does this mean? The rhythm on its own. It beats on its own. Even if you cut the nervous system, you cut endocrine system, it will still beat on its own. Why? It has its own nervous system network. Its own network is called, have you heard of the pacemaker? That's the one, okay? This is the one that sets the rhythm of the heart. Okay, so when we open up our heart, what you will notice is it's cardiac muscle. There's 3 layers to the heart. The inner layer is called endocardium. The middle layer is called myocardium. And the outermost layer is called pericardium. We just studied the pericardium, right? So endo, inner lining. Myo means muscle. And then there's pericardium. Do you follow? The endocardium is epithelium, I'm thinking, right? It must always be smooth. Your cells always secrete substances to make sure it's smooth. It's called endotheliums. You don't need to worry about that. But it always makes sure it's smooth. The only time it will start becoming rough is it depends on the diet, or maybe you have bacteria. All it takes is one bacteria and then they start clumping, or not clumping. They start grouping together, then you have a roughness. Okay? Okay, so here within the cardiac muscle, it looks like cardiac muscle. Even if you look at it under the microscope, it is cardiac muscle. There is 1% of the cardiac muscles that make up the heart. The function of muscle is to contract, right? But that 1% of the muscles of the heart, even though they look like cardiac muscle, their function is to continuously fire. So they function as nerves. That's why the heart is autorhythmic. So they continuously fire to stimulate the rest of the heart muscle so they will contract. Are you following? You understand what autorhythmic means? It beats on its own. I remember in your comprehensive final exam, true or false, I said the endocrine system, and I will use capital letters, does not set the fundamental rhythm of the heart. That's true. The nervous system does not set the fundamental rhythm of the heart. That's true. It has its own called pacemaker. Okay? This is its own nervous network. So the statement that no nerve contracts unless it is stimulated is true. Except for this one, it's its own nervous network. Are you following? Okay? So I look at it, and it is what functions as nerve. It's cardiac muscle. It's cardiac muscle. But it just constantly depolarizes. You remember the word depolarize, action potential? It functions as nerve. Okay? Can I ask you, what do you think? Of the 3, it constantly fires. Of the 3 parts of a neuron, the cell body, the dendrites, and the axon, which of those 3 parts is represented by the pacemaker of the heart?
Axons.
Very good. The axon. It does not depend on a stimulus. It just constantly fires. Okay? And they have different, so you have different, it's called nodes or areas where the action potential fires. So you have it in the SA node, which is in your atrium area, then you have the AB node, and then the AB bundle, then the right and left, and then the Purkinje fibers. So they all have different rates of firing. The one that has the highest rate, it's about 100 times a minute, is the SA node. By the time you get to the Purkinje fibers, it slows down to about 30 to 40 times a minute that it fires. Just by knowing the rate of firing of every node gives you an idea. If a patient comes in, let's say complained of heart pains, etc., and then the heart rate slows down, then you do EKG, you say, oh, there was an MI, you can just by you listen to the or feel the pulse rate, you can have an idea of where in the heart is the problem, right? Because if the heart rate slows down, I am thinking that this is no longer working. Does it make sense? Because this is the one that fires the fastest. Now, if your heart rate slows down, this must be the one that's taking over. So I know that your problem was somewhere up here. Does it make sense? Okay? Okay? Okay. I open up the heart, and it's easy for me to see which one is the right, which is the right side, and which one is the left side. When you open up the heart, that's what you should do. The right side pumps blood to the lungs. How far is the lungs from the heart?
Right there.
It's right there. Very good. The left side pumps blood to the rest of the body. Which one has to work harder?
The left side.
The left side. So, the left, by looking at it just with your naked eye, the left side is always thicker than the right side. Okay? That's how I figure out which one is the left and which one is the right. Okay? Okay. And then, lastly, before we move on with the study of the heart, is heart muscle contraction. By the way, this one, this nerve impulse, how does it, there is no, you remember the synapses, right? The neurons, they synapse with another one. You remember at the synapse, there's a space, you remember that? Where at the axon terminal, they have to secrete their neurotransmitter, right? And the neurotransmitter has to go to the dendrites. There is no such thing as no such type of a synapse when it comes to the heart. The synapse is called a chemical synapse. Sorry. Electrical synapse. Electrical synapse. So, do you remember the intercalated discs? This one right here. See, there's no dendrite cell body. It fires very quickly. The action potential here, it's very simultaneous, so that it's almost instantaneous. The whole heart, even though it's lots and lots of muscle cells, it just beats, it contracts like it was one big cell, because there's no delay, there's no neurotransmitter involved. It's just quickly pass through to the next, okay? Okay. I want to review muscle contraction. Do you remember how does muscle contract? Do you remember that? You have I'm going to use a bit. You remember you have your neuron, you generate a muscle action potential, you remember that? And the result of muscle action potential is the release of calcium. Just a review from the sarcoplasmic reticulum, remember? And then it triggers the actin myosin contraction. You remember that from by 241, okay? It's the same. This is muscle, right? Except there's something very important that we have to add. This is why calcium is so important to life. For those of you who have worked in the ER, you look at one of the things that a crash cart contains is calcium gluconate injection. This is because this pacemaker, right, when it stimulates the heart, the result of stimulation of heart muscle is the entry of calcium from the interstitial space or extracellular calcium. Calcium enters, and that calcium is the key that triggers the release of the calcium that is stored in the sarcoplasmic reticulum of your muscles. Does it make sense? This is referred to as calcium-induced calcium release. Are you following? Again, when my pacemaker fires, what does it do to the heart muscle? It will promote, so this is my pacemaker. The result of pacemaker stimulation of my heart muscle is the entry of extracellular calcium. That is the key. Calcium has to enter. It's the key for the release of the calcium that is inside the sarcoplasmic reticulum of my heart muscle. And we know that this release is the key for actin myosin complex sliding filament, right? Now you understand why if you have some patients or you have some relatives, aren't they on calcium channel blockers maybe? That is it. You're blocking the calcium channels. So some heart patients maybe they have an enlarged heart. You don't want to overwork the heart already, or their heart is failing. You give them calcium channel blockers to regulate so as not to overwork. It's failing. You want to help the heart. So you want to work it just to the point that the normal point, not too much. This is the reason why we give calcium channel blockers. And this is the reason why we have that calcium injection in the crash cart. Patient comes in cardiac arrest, they can inject that directly into the heart, and that can save the life of the individual. It may make the heart start beating again. And this is why we always have to take our calcium supplements. Now you understand why calcium is stored right here in your this is a good bank for calcium. It is so important to life that the calcium level in the blood is always normal. You cannot afford to have low levels of calcium in the blood. You see, you appreciate your endocrine system. It's beyond their control, right? That calcitonin and parathyroid hormone, they just want to make sure there's always normal circulating calcium in the blood. For what? This one.
What does the CICR stand for?
Calcium-induced calcium release.
And that's what the pacemaker does? Or is that what?
Yes, that's
Okay.
so first we start with pacemaker, right? The pacemaker stimulates the heart muscle. So how does the heart muscle respond? It responds by opening channels to let calcium in. Calcium goes in because that's the key. Calcium is the one that will tell the calcium in the sarcoplasmic reticulum to be released. Then your sliding filament happens. You got that, everybody? So I'm going to look at this pacemaker here again. I'm going to picture in my head, right? Let's picture in our head, this one fires. How does the muscle here respond? They respond by opening calcium channels, right? And then the calcium enters from outside. The calcium enters, and it's the key to unlock the sarcoplasmic reticulum to release all the calcium that's stored in your sarcoplasmic reticulum. Then sliding filament happens. That's how this contracts, and that happens in sequence. Do you see this one here? Then this one, then this one, then this one. It's in sequence, right? Does it make sense? This, the four chambers of the heart, the two superior chambers are called atria. You have a right and a left. And the inferior chambers are called ventricles, right and left. The job of these chambers is to just pump and move. You move the blood, goes to this chamber, you move it to the next one, move it to the next one. That's what they do, right? The atria are referred to as your receiving chambers. They receive the blood. The ventricles are your discharging chamber. The way I try to remember, the atria has a letter A, right? It's like a roof, so it drains on the atria, and the ventricles, it pumps the blood away. So this is my receive, receive, then discharge, receive, discharge. I want to ask you, what do you think? What's the best way? Do you think that the atria and the ventricle, you think it's good for them to contract both at the same time? No, right? That's not good. It defeats the purpose, right? I'm thinking atria should pump first. While this is open, atria should pump, the blood goes here. Then ventricle pumps, then open, pump, 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 pump. Does it make sense, right? If they pump at the same time, there's no direction. There's no direction, right? So now here comes what makes it possible. There must be a delay, I'm thinking. There must be a delay because what happens when you stimulate them, they just pump, right? You stimulate this, it pumps. So something, I told you about the electrical synapse where it's fast. Something must be delaying, causing a slight delay so that this gets depolarized and it contracts as this one is getting depolarized. So there's a slight delay. What causes that delay is called the cardiac skeleton, or the fibrous skeleton of the heart. A skeleton. You know how your skeletal muscles, they attach to your skeleton. So the heart muscle is anchored to what you call a skeleton. And you know the valves, right? Are you familiar with the valves? The valves are connective tissue. I'm going to look at this picture over here, just over here. So this is not muscle. Your valves are connective tissue. And when you open up your heart, okay, I really want you to feel this valve. It is so strong. It's tough connective tissue. It's not muscle. Please feel everything, okay? Because that's the only way you can truly communicate with your patients. You understand the anatomy. Because I want you to feel also when it comes to your veins. There's a difference, okay? So be feeling them. So this connective tissue here forms what you call the fibrous skeleton or the cardiac skeleton. And if you look at the slide over here, it says it's a structural foundation. It's like it's where the muscle anchors, right? And then the point of insertion. But to me, this is the most important function of that fibrous skeleton. It's an insulator. So it's like a hurdle, right? There's like a delay. It's not muscle, it's connective tissue. So there's a delay in the propagation of the action potential from the pacemaker. that delay allows the atria, if I go back to this picture, because of that delay. So here, pacemaker is over here, right? I stimulated this, it will contract. But then there's a delay here. So because of that delay, there's a delay in stimulating this to contract. By the time it contracts, the blood has already moved from here to here. Do you follow? That's why it's in sequence. Yes? Okay? So, break for 5 minutes, then we continue with our lecture.
So the delay